afternoon, and thank you for joining us for the Dr. Fazil Show. We're here with Dr. Fazil for our March 2021 edition, and we're going to be discussing the COVID-19 epidemic and the good, the bad, and the ugly with it. Thank you so much, Dr. Fazil, for joining us today.
Thank you, Wendy, and thank you our audience for having me in this show today. As Wendy said, the topic for discussion today is the update as of now in a global pandemic of COVID-19 infection. As of today, unfortunately, we have 500,000 people which have died in US alone, and more millions of people have died globally. So that's the sad side of the this epidemic. The good part of the epidemic is that it is getting better, at least in the USA at this moment. We have inoculated around 20 million people so far, and by doing that alone, it has reduced hospitalization dramatically.
So, Dr. Fazil, with the 20 million that we have that have received their vaccine so far, with such a small number, I know 20 million seems like a large number, but in relation to the population, how is the 20 million that we've already vaccinated making such a huge difference in the hospitalizations and the transmission?
So that's a good question. So the reason is that from the get-go, the strategy was very smart. That give to high-risk patients first, people who are first responder, who are more prone to infections exposure, and people who have comorbid conditions like respiratory illness, obesity, heart conditions, diabetes, and people with advanced age, give them first, and exactly that's what happened. So those 20 million people which have been inoculated are the one which has been was the highest risk category, and by doing that, it has dramatically decreased the hospitalization and mortality rate at the same time. Obviously, we need to have around 75% of the population to be inoculated before we can get the herd immunity, and at that time, I think we'll be out of the woods at that time. Yes.
Also, can you explain to our audience what herd immunity is?
So the herd immunity is that when there's like a herd, as a nation, as a community, as a society, when we live together, not necessarily every person need to be directly inoculated. They can get indirect inoculation as well through antibodies which is passed on from person who have been a person who get inoculated and has infection. They have weak virus now. The virus is not strong, but they transmit it to another person. So that weak virus has been transmitted to a second person which has not been inoculated. So they produce immune response without getting sick. So this is known as herd immunity. So it's passed from one person to another person. It's kind of like vaccination, but not vaccination. So, but you have to have enough momentum to develop the herd immunity, and 75% is the key number.
So it's basically just working against that virus to weaken it.
Right. So basically, people who already have a full immunity, they pass on their immunity to people who don't have immunity because they have not got vaccination, and through the way the virus spread, like through respiratory transmission, so they will get infection from people who have got immunity, and people who haven't got immunity through vaccination, they will get immunity through droplet infection from the people who are immune. So then they actually get lower dose of virus because they are getting it from people who are already immune, but they're not replicating that much in that person. So once they get infection from that person which has already been immune, it will be a small dose, and that small dose will cause a full-blown immune response into that another person which has not had vaccine yet, and then they will become immune to the virus when it comes, when the real virus comes in. So that's the basic concept of herd immunity. So you're getting immunity without getting vaccination from the person who already have got either infection and got immunity, or they have vaccine and then got immunity, but they, one way or the other, they are the one who are actually spreading infection to non-immune person in such a way that it does not cause them to be sick, but they develop immune response the way they would have got it from vaccination. So that's the concept of herd immunity, and it's not unique to this virus. It is it is common to any other infections out there, you know.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
As the vaccinations increase, do you think we're going to continue to see the downward numbers through the hospitalization and the infections?
And I think that's what we're already seeing now as we speak. There's one variable which we have to stay focused on is the mutation. As we know that we have a South African strain, the UK strain, and now we have a local strain from like an American strain. And it's common with all the virus and endemics and pandemics the way it is. So it is not an alarming thing, but it is something we have to keep an eye on it, because we live in a new society. It's a global society. We are not just localized to one place. We travel. We all, as a human being, we travel. And by doing that, we bring virus from one place to another place. As the people from other countries are coming to the USA, they obviously will bring a new strain which we have not seen before. Although the vaccine which we have been giving so far, Pfizer and Moderna, it is also been seen in clinical trials that it has been also effective, not 100% but partially to those new strains as well. But we have to be cautious, and there's a possibility that we might need a booster shot from these Pfizer's and Moderna's vaccinations to protect the new strains as they evolve in the future.
And will we be expected to get this vaccine yearly, as we do with the flu vaccine?
That's a possibility that it might become a new norm, or might be able to eradicate it altogether. To eradicate it altogether, the whole world have to be inoculated one way or the other, and that's where we are heading now. So we know not only that Johnson & Johnson and other big companies are inoculating people in, for example, in the USA, but also they are focusing on the underdeveloped countries as well at the same time. And I think that's important, because if we don't treat the whole world at the same time, the virus will bounce back and forth with new strains every single time, and that it's just a matter of time before it becomes very deadly, and that will have a whole new danger zone, I will call it. So before that happens, we need to inoculate the whole or most of the world. And once we, as we know, in the past there was some infections which have been eradicated altogether from the world. And if that happens, then obviously it wouldn't be any seasonal thing. But if that doesn't happen, then obviously every year we'll keep having new strains, either locally or internationally, and we might need to keep getting the booster shots, just like vaccine we get for flu, So either way is possible. It depends on the joint forces together, global efforts to inoculate not just people in USA or China. Actually, these are two big countries which has been inoculated the most so far. I mean, if you look at the global map, the highest rate of inoculation at this moment is in China and USA. That's not enough, because we have 7 billion people. There's 1.2 billion people in China. There's 300 million people in USA. Missing quite a few people.
Right.
So that would not work out if they're left alone.
So you say that we have to vaccinate the entire world basically at the same time. What kind of time frame are we looking at? That's a lot of people to vaccinate, and it's not going to happen clearly overnight. So what kind of time frame are we looking at that we need to work into?
Well, I mean, wishful thinking is right away or just today. I mean, that's a wishful thinking, but what the projection is by the end of 2022, that's what they're looking at. Like, we should be able to, as I said, we don't have to have 100%, we need 75% of the population to get herd immunity to kick in, and to get that level where the logistics are, we're looking at, as a matter of fact, another year and a half of this genie which have come out of the box, or out of the bottle, I would say, which is going to stick around for another at least two more years. 2 more years. And that's if everything goes the way it is for now. But if a mutation happens and become more deadly, or another pandemic kicks in, then obviously the dynamic will change. But that's what we're looking at.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
And are we going to continue to see our communities coming back to kind of an adjusted norm?
I think the new norm is going to be, since we already adjusted to the new norm, like a lot of things can be done online and remotely, and this pandemic have broken the sound barrier. It was an inevitable thing anyway, where, with the new technology, like if you can do shopping online, why bother going to stores? Or if you can work from, for example, your home, why bother going to work if you get the same results or better results? So I think it has changed the norms, it skewed the norms in one way anyway. And I don't think people will go back to traditional things if they don't have to. And that's one thing. Mask we might have to keep wearing for another year and a half till we have full control in this giant. And the new norm would be new normal. The change would be new normal. I think the question would be is like mask or no mask. I think that's what your question is. Are we keep wearing a mask forever, or is it going to go away at some time? I think it will go away most of the time by the end of this year. Probably almost all gone by 2022. So yeah, go ahead and buy the designer's mask. Yeah, that seems like the new normal now.
Right.
Yeah.
So we have the vaccine from Moderna and we have the vaccine from Pfizer. Do we have any update on the Johnson & Johnson vaccine yet?
Yeah, so we got a breaking news today that Johnson & Johnson got approved for emergency use only. The difference between Johnson & Johnson versus other vaccine is it is only one shot and you can keep at the room temperature as compared to other vaccines. So it make logistically more effective than the other two vaccines, although it is 70% effective. But we have to remember, flu vaccine is only 40% effective, and we will still take it. So 70% is almost twice as much than the flu vaccine, which has been in the market for years. So I think it's a big breakthrough in medical technology and the healthcare industry. So 70% seems like less than 95% what Johnson & Johnson offers. But again, 70% is good enough to keep you away from the hospital. Okay. And it will reduce the fatality rate, and you might have symptoms but not severe symptoms. So remember that flu vaccine is only effective 40% and you still take it and we don't have major side effects. And real flu hits one of the patients. But with 70% is pretty good actually, with single shot. Because logistics of giving two shots is twice as hard. So I think by giving one shot, we can double up our speed of inoculation. So I think that would be a major breakthrough and a major benefit to in the treatment of and controlling the pandemic at this moment.
And are the side effects similar to the Moderna and the Pfizer?
Yeah, they have a similar side effect, and most vaccines have the similar side effect. I mean, you get a little flu-like symptoms, some muscle aches and pains, some slight fever, might be some allergic reaction, but nothing out of the ordinary.
Okay. Thank you, Dr. Fazil, for being with us again today. This wraps up our March 2021 edition. Thank you so much, and hopefully we'll see you next month during our April 2021 edition, and we'll have good news to follow. Thank you so much.
Thank you so much, audience, for watching this show, and stay tuned. We'll be back next month with more information, but so far so good. Have a nice day and God bless.
Thank you.